Hi, this is Dr. Rukmani Chaudhary and you're watching Dr. Rukmani's Health Update. My today's topic is anal fissure. So in today's video, I'll be talking everything about anal fissure, like what are these conditions and how these are formed, what are the causes behind these anal fissures, what symptoms do you have, home management, how can you treat this condition at home, best effective homeopathy medicines. So you're requested to watch complete video for complete information. If you're watching first, like, share and subscribe my channel for further notification. So let's begin. Anal fissure. So anal fissure, anus, the last part of the intestine, lining, the inner lining of the anus that gets affected means you have cuts, there are cracks in the anal area, in the inner lining of the anus. So this can be very painful at times. This can be very serious condition. All age group affected, but mostly like the infant, newly born babies and the middle-aged adults are most at higher risk. The cause is why you have anal fissure. See, the causes are usually it is blamed that if you have low fiber rich diet, means there are low fiber in your diet, yes, you are at a risk of having constipation. So chronic constipation means large hard stool can contribute to the frequent diarrhea, frequent loose motions, so obviously your inner wall of the anus is affected. So there are cracks, there are cuts. So this can again a risk of having anal fissure, and at times these things are not blamed when you have recurrent anal fissure. So anal fissures are at times resolved on its own. So at times there is no treatment required and no even medical attention is required. It gets resolved on its own if you manage it properly. In some cases where these are like recurrent kind of anal fissures, so we have to look into the underlying cause, and there can be at times serious conditions. Underlying serious conditions can be inflammatory bowel disease, means your intestine gets inflamed. So there can be inflammatory bowel disease, and there can be poor blood supply to the anorectal area, means the particular part that is having poor blood supply. So in that case also you have anal fissures, and there's a spasting, there's a tightening of the anorectal sphincter, the muscular sphincter that gets tightened up. This can again put you on having the anal fissure. Training during childbirth, no anal sex and any object inserting into the anus. These things put you on higher risk or having anal fissure. So these are certain kind of causes or risk factors. Certain rare disorders. Yes, there are certain rare disorders. These are rare to rarest. At times these can contribute to having anal fissures, and these can be anorectal cancer, these can be herpes, tuberculosis, even HIV. So what sign or symptoms you have while you have these kind of fissures like anal fissures? You can have like there's a visible tear, visible cracks in your anal skin, and there's a skin tag just attached or just very close to the anal fissure. You might feel the anal tag, and there's a visible skin tear, visible skin cracks are there, and it is very painful. This is very painful, very sharply defined. So you have sharp shooting pain, and there's a burning, there's itching, and there's a spasm at times. Spasm are associated, means you feel tightening up of the muscles of your anal sphincter. Be bright red bleeding, itching, obviously burning and itchings are found. Now how you can prevent this condition? Is it like preventable? Yes, it is preventable. And at times if you have anal fissures, so this recurrent means you have recurrent tendency. So in these cases you have to maintain precautions you can take so that you can avoid having these again and again. So having plenty of fluid again is a better option. So you can have plenty of water, plenty of fluid. So obviously there is a less chances of having constipation. Having fiber rich diet, so just have fruit and vegetable rich diet. Having fiber rich diet, again a good option. Area clean, so just keep the area clean so there are less chances of infection. So keeping the area clean and dry can prevent you. So exercising regularly gives your muscles a tone, and there is a proper movement of your bowel. Yes. What about the home treatment? How you can treat it at home? This is the condition that that resolve on its own. This is not as serious, but at times when it is recurrent and there are serious underlying causes, in that case you need medical attention. Otherwise this can be resolved on its own and at home. So first of all, there is a severe pain, so you have to manage that pain, and for that you Sitz Bath. So just taking Sitz Bath, having Sitz Bath taking warm baths helps you a lot. That relaxes your anal spasm, that relaxes your muscles, and that even reduces your swelling. So just have Sitz Bath. Using topical ointment, topical pain relievers, even in homeopathy, FP ointment. So you can use that particular FP ointment, and that gives you pain relief, and that reduces inflammation topically, locally. That reduces your anal swelling, inflammation. Softener. The main cause is that you are having large and hard stool. So you have to keep in mind that you have loose stool. So making your stool loose, obviously it prevents, like, there will be no cracking, no further damage. So just make sure that you have loose stool and you are using stool softener. We'll talk in the medicine part. Being active again gives you the moment, the bowel moments. About homeopathy and what are homeopathy medicines you can use. See, in homeopathy there are two factors. Keep in mind that first thing, your holistic approach, that what all symptom you're having, what is your case. So this is like individualization and holistic approach. If you're watching on YouTube, I have provided all medicines link in description box below, so you can buy medicine and you can start your treatment. And these are like homeopathy medicine. You can only find these medicine only on homeopathic pharmacy store, be it a physical pharmacy store or be it online, but only on homeopathic pharmacy and store. You must be knowing Brownia about its character. Like, this is given in the constipation. So you have chronic constipation, you can use Brownia. Brownia is given like in the dryness cases. You have large stool, dry stool, and there is a hard stool. So Brownia is indicated in these kind of cases. So Brownia can help you in these kind of cases. Just take 1 or 2 drops twice or thrice before having your meal. This is like bigger quantity. You can even buy a smaller quantity, and this is in the drop form. Just take with the help of dropper, direct on tongue, and if there any problem, just add some water. Acidum nitricum, you will fissure, even in fissure. So this is very effective. This again tops the chart that this works amazing in anal fissure, where you have cuts, there are cracks, there are cuts, pain and bleeding as well. So you're having bleeding and you're having sharp shooting pain. So both the symptoms are covered by acidum nitricum. Again, with the help of dropper, 1 or 2 drops twice or thrice before having your meal. So you can take this medicine if you're having these kind of symptoms. So just go with the medicine symptom and just try to match your symptom with the medicine symptom, and then use that medicine that is the most similar medicine in homeopathy, and that cures you. Actually, that is the best indicated medicine, and that's called a remedy. So graphitis, you must be knowing about this constitutional remedy, that you face there is a overweight, obesity, and these kind of cases having constipation, chronic constipation, and sharp shooting pain, large stool. So graphitis is the medicine choice of the remedy in these kind of cases. It's like thuza. Thuza is given when your anus is sensitive, and there is a medicine that is Ratania. Ratania tops the chart. Tops #1 medicine in fissure. Ratania covers all the symptoms of anal fissure, sharp shooting pain, swelling, inflammation. Everything is there. So Ratania is indicated. It is given when you have anal itching. There is an anal itching, there is burning. So in these kind of cases, petroleum is given. And there are again hard and lumpy stool. So in these kind of cases, petroleum is like FP tablet. It is given in the fissure or piles cases. So this is in the tablet form. Just take 1 or 2 tablets twice or thrice weeks till the time to you start feeling difference. Rec R13, piles and hemorrhoid. This works amazing in fissure cases. So this is in the draw form. Just take 5, 10, 15 drops in some lukewarm water. Just take it like 2-3 times in a day before having your meal. So just very effective. Very good medicine. For the stool softener, this is known as a stool softener. Homeopathic, just take 1 tablet bedtime, and if you're having severe, just take 2 tablets bedtime. Then you can take in anal fissure. So hopefully this video can give you some amount of help. If you find this video knowledgeable, informative, please like, share and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much.